to safely infuse solutions through an elastomeric infusion device. We have our antiseptic hand gel, we have our filled elastomeric infusion device, we have our saline syringe to flush the catheter, our alcohol pads, gloves, non-sterile, if that's your protocol to use gloves when starting an infusion and flushing a catheter. We have tape to secure the device to the skin, and our waste pouch to hold the elastomeric infusion pump. Check the patient's label on the infusion pump. You want to make sure that this rate is the same as the rate indicated on the prescription. Check that it is within the expiry date that will be indicated on the label. Look to make sure that there's no leaking, that there isn't any fluid sitting inside the container. And check, of course, as with any infusion, that the solution is clear, that there's no particles floating inside. Wash your hands. Now you need to flush your catheter to make sure it is working well. Open your saline pre-filled syringe. 0.9% sodium chloride is the solution we use. Read the label on the syringe to make sure you have the right solution. So we have normal saline. With this syringe, there is a bit of an air seal, so you need to push up on the plunger until you feel and hear a pop. Remove the cap, making sure you don't touch the junction. Once you've removed your cap, you need to expel the air from the syringe. So holding the syringe upright, push on the plunger to expel any air until you see a bubble at the top. Take your alcohol pad. You now need to scrub the cap on your vascular access device using friction, but you should be scrubbing for 15 to 30 seconds, making sure I get the flat end as well as the threads on the side. And I'm aware of where that open end of my syringe is so that I'm not contaminating it. Discard your alcohol pad, allow that alcohol to dry, wait 15 seconds, attach the saline syringe, push in and twist to the cap. Open the clamp if it's not opened already. Flush your catheter, pushing on the plunger of the syringe. As you're pushing on the plunger, you're assessing how easily that fluid is going in. With another alcohol swab, scrub the cap once again with friction. Uncoil the tubing. I'm going to remove, twist off the winged cap. You'll notice I'm holding the cap, ensuring that the cleansed end is not touching anything. As well, you want to ensure that you do not touch that open end of this tubing. We now attach the tubing of the elastomeric infusion device to your vascular access device. So I'm going to push and twist clockwise until I feel it firmly secured. Ensure that the clamps on your catheter, if there are clamps, are open. If there's a clamp on your elastomeric infusion device tubing, make sure you open that clamp. The solution will now automatically start flowing. It's that easy. You then need to secure the tubing so it doesn't get caught. So with a piece of tape, loop up the catheter and place a piece of tape, not on your dressing, to secure it in place. You can also put another piece of tape here if you wanted to prevent it from being pulled out. And then you simply place the elastomeric device into the waist pouch and secure it to the patient's waist using the belt, or you can place it on their bed if they're resting in bed, or hang it on the arm of the chair. You can look at the device to determine if the balloon is shrinking. There are graduated markings on the side of the pump that you can use to assess that your infusion is progressing. This is what it looks like when it is full. Here's a pump that has only about a quarter of the infusion remaining. You'll know the infusion is complete when your reservoir container looks like this, where the balloon is completely deflated, and you can actually see the little bumps on the inner tube on the elastomeric device. That means that infusion has completed. To help ensure that the infusion progresses at the appropriate rate, the pump should be at room temperature before hooking it up to the IV catheter. So we recommend that you take the pump out of the fridge, ideally 6 to 8 hours before hooking up. If you start it with the solution cold, the infusion will take longer than expected. Heat will also increase the rate, so avoid going out in high temperatures. Height will also affect the rate the fluid flows. Once the pump is connected to the catheter, keep the top of the pump as close to the height of the IV device to ensure accuracy of flow rate. If you raise the pump, it will run faster. If you lower the pump, so it is below the height of the vascular access device, it will run slower. When the patient is sleeping, you can keep it tucked under the pillow. You need to store the filled pumps in a refrigerator until ready for use. When the infusion is complete, you need to disconnect the pump. So remove the pump from the pouch. Look at the device to make sure that that balloon has fully deflated. The first thing you're going to do to disconnect the pump is wash your hands. Put gloves on if that's your policy. If there's a slide clamp on the tubing, you would close the slide clamp. I'm going to close the clamp on my vascular access device by squeezing this. Disconnect the pump by twisting the end of the tubing, that's this white portion, from the cap. So I have my one hand on the cap and the other on the connector, and I twist counterclockwise, twist the end of the tubing to remove it from your IV. Dispose the pump, scrub the end of the cap, pushing on the plunger until I hear a pop. Push on the plunger to expel any air until you see a bubble of fluid at the top. Insert your syringe into your cap with a push and then a twist to lock it on. Open your clamp, flush your catheter. Push, stop, flush, where you push, stop, push, stop. Twist the syringe off by turning it counterclockwise. A final reminder of tips for success. Make sure that you take the pump out of the fridge to allow the solution to come to room temperature so it infuses at the proper rate. Make sure you've checked your catheter, flushed it with saline to make sure that it remains patent. And try and keep the top of the pump at about the same height as the lure lock connector and catheter. And this concludes our program. We hope that this review provides you with both the knowledge and skills required to care for this elastomeric Intermate infusion device as you strive to deliver excellence of care in infusion therapy. At medical pharmacies and OMS, we are committed to facilitating continuing education with the common goal of optimizing nursing and patient outcomes. If you have any questions, please do not hesitate to contact us at Medical Pharmacy.